guys, I'm Paige Hastings, nurse practitioner at Dr. J.J. Wendel Plastic Surgery. We have had several questions about lip fillers, and I thought that we would just touch on a few of those and answer a few of those really frequently asked questions. So let's just start with what fillers and how we use them and why we use them. We use different types of fillers depending on the lip. So I have maybe my more mature patients who have thinner lips, maybe some perioral lines. I'm gonna use something like Wendel, which is a much thinner filler that isn't going to give as much volume, but is gonna camouflage some of those lines and rehydrate a lip so that it doesn't look as flat and maybe wrinkled up. My younger lips, to also some mature lips that maybe want a little bit more volume, I might use something like Velour or Restylane Kiss. Those are gonna have still a very natural, expandable, stretchy lip that's gonna look normal when you smile, but it's gonna have a little bit more volume. And we can also titrate how much volume we want. I think most people will think that one syringe is gonna give them this big luscious lip, and that's not necessarily the case. One syringe of filler is 1 cc, and that is actually 1/5 of a teaspoon. It can take 5 syringes, or it does take 5 syringes to make a teaspoon of filler. We're never gonna put that much in a lip, and we would never put more than one in a lip at one sitting, but we will often have people who want a little bit more volume and will need to have multiple syringes done in multiple sittings, usually around 4 weeks apart. Longevity is another question that people have. How long does it last? Anywhere from 6 months to a year. It really just depends on the patient. How quickly you break that filler down is very independent upon person. So usually I'll see some people in about every 6 months, and that's usually someone who wants a much more full lip, and then I'll have folks who come in annually and do some touch up. Another question is, does it hurt? We try to make it as comfortable as possible. We're always going to apply a topical numbing cream. We let that sit for usually around 15 minutes or so, try to get you as numb as possible. The product itself, all of the fillers that we use have lidocaine in them, and that's gonna give you some numbness pretty quickly after we initially start the injection. We use a cannula for most injections. We'll use a needle as well, but a cannula is just gonna have a couple of little entry areas, and then we will just glide that right up into the lip. And I have patients who say it doesn't hurt at all. And then of course, everyone's individual in their pain perception. And some people, you know, it's uncomfortable, but they keep coming back for more. So I figure it's not too bad. But we're always going to go easily and smoothly, and we're never gonna force anything. So we're always gonna make sure you're comfortable. Cost is a big concern for some folks. It is very dependent on which filler you use, how many syringes you use, but anywhere on average, probably between $700 and $800 is typical. We're always gonna have you come in, talk about what you're wanting, what you're looking for, what your goals are, and we'll come up with a plan. We're gonna quote it to the penny. And Allergan and the Galderma rewards programs, and they are gonna reward you every time you come in. And most people will have $20+ to spend at each visit as a reimbursement from the company. And we're always going to also try to offer specials when we can, and if you combine that with Dysport or Botox, you'll get deeper discounts. So really, we just encourage patients come in, let us take a peek at you, let's talk about your goals, let's come up with a plan, and we'll go at your pace and try to make you as happy as possible. Hey again, so now we're gonna talk about a few more frequently asked questions that go along with post-treatment. And one of those is, what can I expect immediately after? Immediately after, you can expect some swelling. Swelling usually really takes effect certainly in the evening and definitely the morning after. Most folks experience swelling for about 1 to 3 days. It's very important to help decrease that risk of swelling to take it easy. We want you to really kind of lay low for maybe 2 or 3 days, no vigorous exercise, no heavy lifting. Nothing that's going to really cause that heart to get pumping and cause that swelling and potential bruising, because that's another big side effect is bruising. It doesn't always happen, but typically there may be a little bit of bruising. That can vary in its extent, and it can vary in how long it lasts, but it's usually only for a few days. We tell people you can really minimize that by a few things: not taking a lot of Advil or aspirin in the days leading up to your procedure. Fish oil can also cause some thinning of that blood. We don't want you to drink a lot of alcohol before or after either, because that can also precipitate bruising. In rare circumstances, people can swell significantly, but for the most part, it's very minimal, and most people can go out even within that next day or two after. Typically, probably the most common thing I hear when I see people for follow-up is, hey, I really liked how my lips looked swollen. So you get used to it, and then we often end up doing a second syringe to pump them back up a little bit. The things that we recommend also post-care avoidance, there's really not a need to massage. There's really not a need to ice it. You really should not have pain after, and that's a very important thing to remember, is you'll be sore, but if you have severe pain, we need to know about it. Discolorations outside of just minimal bruising, we need to know about it. There are complications that can occur. They're extremely rare, and we will go over those in your visit, but we can certainly give you an idea of when you need to call us and when you need to be concerned. Other than that, take it easy, enjoy your lips, come back and see us when it's time for more. But I hope that answered your questions. Please reach out to us at any time. We would love to answer those for you anytime.